I am super glad to be able to have this interview today on the DiepCJourney Foundation resource page to provide this educational information. My guest today is someone that I met recently this fall 2024 in the US over at the American Society of Plastic Surgeons meeting. I'd like to introduce him quickly. His name is Saahil Mehta, and he is a consultant plastic surgeon in London and the founder of PLEXAA. That's what we're going to talk about this morning. So during his training in London, Saahil looked at the use of supraphysiological preoperatively improving the blood flow to the skin. He's going to tell us more about that because that is such a mouthful. I'm sure it comes trippingly off the tongue for you, Saahil, but a little bit more difficult for me. Would you just tell us a little bit about yourself, your training, and your product? You have a good slide presentation that we're going to share today also, so I'll let you take the stage. Thanks for joining me, by the way, and it's
But
really good to see you. My gosh, you've been on a road trip.
yes, yeah. Thank you so much, Terry. It's really great to be here, and
Mm.
thank you so much for the invitation. And I'm really glad we get to do this again. It was nice to meet you in San Diego. But yes, my name's Sahil, and I am a consultant plastic surgeon here in London. I did all my training here in London. The room I'm at the moment is in a place called Somerset House. Some people may know it. It's right next to the river, River Thames, and between that and Covent Garden. And actually, what I'm about to tell you about is a research project that turned into a medical device company. And I did that research just down the river at a very famous hospital called St. Thomas's Hospital,
Mm.
which looks directly at the Houses of Parliament and Big Ben.
Mhm.
And that was all the way back in 2009. And I've been fortunate enough to be in the position to lead and grow this company into what it is, and really to make a difference to the way that women prepare for their surgery, their breast cancer surgery and reconstruction, and really give them a sense of empowerment and more involvement, and also to protect their skin and to give them better outcomes overall. And you did a really sterling effort at pronouncing it. It's supraphysiological preconditioning, and it doesn't roll off the tongue. And actually, we have a couple of French people in the team who struggled for several weeks trying to say that
Okay.
phrase, but they've mastered it now, which is fantastic. So
Good. Well, I'm glad I nailed it this morning over a cup of coffee here in Seattle. But yeah, I'm just excited about this product
yeah,
because I want the listeners to know too that when we were in San Diego, Sahil actually had it with him.
yeah,
So I always like to tell others that I was able to hold it.
yeah.
And it was a comfortable device, just as a little input here, comfortable device. I'm going to let him talk about how it works, but the just the gentleness of the vibrations, I'm going to call them. I'm going to let you give a
Yeah.
little bit more description, and also the gradual heating of this element. And it was just comfortable to me. And
Mm,
so that's what I want to share with the listeners is that it's not something I heard about. I actually
yeah,
got to hold it. So I just wanted to add that
absolutely.
in.
Yeah, thanks for saying that. And one of the things that really resonates with me is that I've always seen us as a patient-centric
Hmm.
company.
Hmm.
All the design we've done has been specifically around patients and people who have been through breast cancer surgery and reconstruction. And actually, what I see with what we've built is that all of that information and sentiment and feedback has really fed into our product. And it really warms my heart to know that you agree in that way. And you barely held it for very long, but it's obvious, isn't it? Which is really, honestly, it means so much to me. So but anyway,
It
um
is. And I want to add that we were in the convention center and my hands were cold. So it was an added benefit.
yeah, exactly,
But
yeah.
yes, and
Yeah.
also the fact that, um, you know, patients think about recovery, what can happen, and to be traumatized by wound healing is not something we ever want to have to experience. So the fact that that really was a lot of the focus of this is very important to me too, for my community.
Absolutely. Absolutely. Should we jump into the slides?
Let's do it. Let's
Why
see
don't we
if
do
I
that?
can get this going here for us. And I'm gonna put this in presentation mode so it's a little bit easier. Saahil,
Yeah.
please let me know if this is okay.
Cool.
Are we good?
Great. Thank you. Yes.
Please tell
Perfect.
me when I need to advance, and I'll do so.
I will do, absolutely. So the company is called PLEXAA, and our first go-to-market product is BLOOM⁴3. BLOOM⁴3 is our breast product, essentially. So what I'm about to tell you is essentially a principle, which is supraphysiological preconditioning, which can actually be applied to any part of the body for any surgical procedure to prevent wound healing complications. So, but, you know, from my perspective, I started this project all the way back in 2009, and I was working as a very junior, we call them house officers here, but it's a very junior resident on surgical residency. And I was working on a breast reconstruction firm in plastic surgery. And at the time, we just started doing something called the skin sparing mastectomy, which I'm sure many, many of your listeners will have had. And if you could advance to the next slide. One of the things that we were seeing a lot of was something called mastectomy skin flap necrosis. So that's abbreviated to MSFN. Basically, in this picture, what you can see is a patient who has had a skin sparing mastectomy where we've removed the cancer by cutting around the nipple and then removing the entire breast with the cancer, leaving behind this skin envelope. And it's that skin envelope that became kind of, you know, was the beginning of becoming standard of care back in 2009. And it's really great for reconstruction. So this patient here has had a DIEP flap or deep flap reconstruction. So that's tummy tissue. You can also fill that skin flap with an implant as well. But the reason, you know, what she's got here is something called skin necrosis, where the skin has died because of a lack of blood supply. And that's on a kind of, a spectrum of necrosis can lead to infection, and infection can lead to necrosis, etc. And the problem with skin necrosis in particular is that it is still pretty common. It does happen in up to 1 in 3 surgeries. And the reason is because thin skin, in order to make sure you've treated that cancer, has a poor blood supply and therefore is very susceptible to skin necrosis.
And a lot of this is due to radiation, prior
Well,
radiation.
yeah,
It can be.
It can be, yeah. So
right.
not all of our patients obviously get preoperative radiotherapy, but yes, that's definitely a risk factor.
Right.
And, you know, when I was working on this breast reconstruction firm, my boss at the time was thinking, you know, gosh, you know, we're seeing this. And he had a friend who had done a PhD in the whole concept of preconditioning in the laboratory. And he had demonstrated very clearly that by preconditioning the skin before surgery, you can improve the blood flow. And in animal trials, he was able to demonstrate that you could reduce skin necrosis by 52%. And that was like, really? And it was a very simple thing to do. And it was definitely having, you know, it was having these incredible results. But just to go back to this patient, you know, the consequences to this patient from skin necrosis like this, and this is a particularly bad example. You know, this was a photo taken quite a long time ago, but either way, it still happens, is that she would have needed to stay in hospital for longer. This patient in particular would have to go back to the OR. She would most likely have to have a skin graft. That's longer healing. And the biggest impact, apart from cost, is actually one of a delay to your following, you know, chemoradiotherapy, which can have a negative outcome on your survival rates. So what we were looking at is ways of trying to prevent this from happening, to make sure that all of our patients were getting to their adjuvant chemoradiotherapy regimes on time. And the principle of preconditioning is this. So if you move on to the next slide.
And I just have to say too, this makes so much sense to me, because you think about athletes preconditioning.
Yes. Yeah.
That's a very simple analogy, but go ahead.
Absolutely. And you know, you're absolutely right. And you know, sometimes the way we talk about this is getting patients race fit for their surgery. You know?
Yeah.
And it's a really good analogy. So you can actually precondition in many ways. And the concept is essentially, if you provide some form of stress to the skin, and you can do that in many ways, as I say. We use heat because patients like heat. You could use cold. You could use pharmacology. You could use trauma. You could even hit the skin. You know, when patients, you go and have your blood drawn, someone hits your veins and it plumps up. That's the same. It's like a preconditioning method. And in the laboratory, this PhD student that I mentioned, what he did was he heated mice to 43 degrees centigrade, which is around 109 degrees Fahrenheit, for 3 half-an-hour bursts interrupted by half-an-hour breaks. And what he was able to demonstrate was that there was a change in the vascularity of the skin, and that was all due to the release of something called heat shock proteins. And there's one heat shock protein, HSP32, that we're particularly interested in that gets released, and that actually causes the release of carbon monoxide locally in your tissue. And carbon monoxide, whilst we know it as a household poison, is a very, very potent vasodilator. So it makes all of your blood vessels open up. And this is the thing, this is why this principle can be applied to all types of wounds, because we rely on blood flow to heal wounds. So improved blood flow always means better healing generally. So this patient here, what I did was I did the translational step. So I did the first randomized control trials of taking what we'd learned in the laboratory and tried it in patients. And we did that in a super simple way. We just used hot water bottles. And I was basically giving hot water bottles, a thermometer, and also a protocol to patients when they were recruited into the trial. And actually, I became known as the house officer who had a white coat, clipboard, pager, and a hot water bottle in his pockets at the time. And what I did was that we asked patients to heat water in a saucepan at home to 43 degrees centigrade. And this was the night before surgery. And they did the same protocol of 3 bursts of half an hour interrupted by half-an-hour breaks. And this patient here, these 4 slides here, show the same patient. This is a patient with who I asked to precondition only the right breast. And she did that the night before surgery using the hot water bottle. And she came the next day for surgery as normal. And we used a special scanner to look at the blood flow. And you can see she's got better blood flow on the right than the left. And then 2 hours into the operation, we're now, it's freezing cold in the OR as it always is. She's not moving because she's anesthetized, and all that surgical handling, you can still see she's got better blood flow on the right than she does the left. So that has the healing advantage. And when we looked at this in a large randomized controlled trial of 141 patients using the hot water bottle, we demonstrated we could reduce skin necrosis by 13% across the board. We could halve reoperation rates. But one of the most surprising metrics was that we could reduce outpatient follow-up by 70%. Basically, what that was saying was that if you were preconditioned and you got some form of complication, so we're not eliminating the problem completely, but we are definitely reducing it. Actually, you healed in the same way. So more patients were having a similar journey to patients who didn't have a complication, so long as they were preconditioned. And that was really interesting. And so at the end of all of that, and this was like 5 years of research, it was, for me personally, it was very much like, well, this is working. This is a super simple, non-invasive, non-painful, easy to do procedure that the patient has control over at home. And how do we turn this into a thing, something real that everyone can get the benefit of? And that's why I founded the company. The other reason, actually, and it's really important to mention this, is that, one patient did get a burn from the hot water bottle. What was really interesting about this patient was she was in the control arm. So she wasn't randomized to do the hot water bottle trial, but she had heard about it. And she went home and decided to just do it all on her own without any supervision, any protocol. And, all she was trying to do was get the best outcome for herself. And so she boiled water in a kettle, poured it straight into the bottle, straight onto the breast skin. She'd had previous radiotherapy, couldn't feel anything. She ended up with a burn. And she's actually probably the catalyst for me, which is like, okay, let's make this as safe as possible so that everyone, regardless if you've had radiotherapy or not, can get the benefit of this, because you really can get the benefit. So that's why we built the device, founded the company and built the device. So if you move on to the next slide.
Did this keep you up at night?
It did, yeah. It's a couple of things. It was her, but it was also the idea of, I can't let this research just gather dust in a medical journal on a library in some medical school library. It's got to mean something. Ultimately, when we go into medicine, we want to make a difference.
Exactly. And why I asked the question.
Yeah, exactly. And there are so many instances of research being done for research's sake. And I will be honest that I have been in that position several times. We do research to, you know, further our CVs and things like that, but occasionally we come across something that can really make a difference. And I believe that this is something that can truly make a difference to breast cancer patients undergoing this type of surgery, and then other patients in other surgical specialties as we go forward.
Oh yeah.
So
when ideas and innovations clash.
Yeah, absolutely.
Yeah.
And totally, it's a lovely clash as well. So
yes.
What you see on the slide here is what you held essentially. This is BLOOM⁴3. It is the world's first fully wearable, sensor-controlled device that allows patients to safely precondition their skin the night before surgery. Now, I have it here, and I always get this bit wrong. So there it is there.
Yep, I can see it.
And I will switch it on, and it switches on. The vibrations that you mentioned, we put in haptics so that a patient just in their bra the night before surgery, they switch it on and it buzzes as it goes through the cycling. So you don't have to keep looking down. Yeah.
And the haptics were so gentle, as was the increase in, and it literally, I didn't do it at the conference, but literally the size of it just slips right into your.
Absolutely, yeah.
Yeah.
And the size we have here is actually for our sort of large B cups to almost F cups, actually. One of the reasons we've gone for that is because when we looked at the demographics on our trial, that was the most common size. But also what we wanted to make sure is that the nipple in particular gets that preconditioning benefit, because that's where your incision is. But also there is this paradigm shift towards more nipple conserving surgery. Therefore, what we're doing by preserving the nipple, we're actually putting the nipple at more risk of necrosis. It gives a much better aesthetic outcome. It always will, but it does put that kind of increased risk on the nipple. So actually what we want to make sure is we're preconditioning that, so we're giving the nipple an extra chance to reduce the risk of nipple necrosis in particular.
Yes, it sometimes gets a little more trauma, I think, because of the makeup of it and the area that you're working in.
Yes, absolutely. And also, if you think about it, if your nipple's at the end of your arm, if you were to do it geographically, your heart is all the way back here. That's your blood supply has to get to the end of your arm, which is where your nipple is. And so that's the furthest point, that the blood has to get to. But, there was one other thing that I really wanted to do with this was the device is great. It does what it's doing. It's got some brilliant scientific data behind it. We've had some fantastic user trials, etc. But I wanted to take it a step further, because there's one question that every single breast surgery patient has asked me before their surgery, and that is, what can I do to prepare? Without a doubt, 100% of patients have asked that question. They've asked things about sleep, about nutrition, physical health, mental well-being, body image, intimacy, all these sorts of things. What do I need to pack for my operation, and all those sorts of things. And one of my observations going through my fellowship and also my training was that all this information is somewhere, but it's massively disparate, and it needs to be consolidated, and it also needs to be in a way that people want to use it and also gives them that active engagement in what they're about to undergo. So we put all of that into an app, and I'm really excited to say that this app will be released in March next year. And we're building it right now. We've got some really great wireframes, and the front end looks fantastic. We're working on the back end, etc. But essentially, the app complements BLOOM⁴3, the device, to really give you this kind of concierge approach to your preparation for your surgery and get you absolutely race fit, not only from the physical skin perspective, but also your holistic well-being. And I honestly, one of the hardest things about running randomized controlled trials is the type of patients you work with. And I will say this now, that the reason I was able to complete these trials is because of the motivation of breast cancer surgery patients. They are massively engaged, massively positive. They want to do as much as they can to improve their outcomes and also pass that knowledge on. And so actually, I really want to give back to this community first. This is what I want to do. And that's why we're starting with breast surgery. It really is. But I mentioned to you earlier, Terry, just offline, was that we had a really exciting step today. We've completed our FDA registration. So we have a number. We're a what's called a class 2 device, but we fall under a code that is exempt from the normal approvals, because we are low risk, we are non-invasive, and we're low energy. So actually we build the device as a medical device. We still have to do all the testing, but we can get this out there. And, you know, we've also had the fortune of being able to partner with Panasonic as our manufacturer, which is huge. They you know, it's kind of caught us off guard, actually. But that means that we're going to be able to start properly manufacturing our device as early as January. And there's some, you know, there's some key institutions in the US that are, you know, we're going to be piloting this device at. And so we're aiming for a launch date next year. So this is just around the corner. And, you know, I couldn't be more excited about this, because just from a personal perspective, I've been doing this a long time now. And to be at this point where I'm actually going to be able to see this bring benefit to patients in the real world, as it were, is huge. It really is. So that's BLOOM⁴3.
So I have two screens. I'm going to look over here. And I'll stop screen sharing after this. Saahil, I'm excited. The progression on this app, prepare your mind, prepare your body. And the last one, make a plan. Talk about, I will stop screen sharing now, but talk about engaging the patient. Those words, make a plan, you are inviting the patient to be part of this. And the word that you used at the beginning, empowering patients, that is so important for those of us who are facing a diagnosis or a genetic predisposition or genetic mutation that puts us at high risk. I'm very pleased about the access. You mentioned that you just today got the FDA approval and I want patients to know the exempt part, because that falls under patient safety. They look at all of this extremely, you know, meticulously. And so because this is low risk for patients, if I'm using the proper words, if I'm not, please interrupt. But that's what's exciting for me. In the Facebook group that I admin, which is DiepCJourney breast reconstruction after mastectomy, they're going to want to know about this. New surgeons are not new surgeons, but surgeons are going to want to know about this. So I'm just super excited that you presented this to us today. We're not getting off of this interview today without you telling us this road trip you've been on and the award you received. Would you tell us about that, please?
Yeah, the road trip was kind of crazy. It was off to the Mayo Clinic, to Texas Medical Center, MD Anderson, and then a couple of hospitals in New York to go and speak to some of the surgeons that want to pilot this, which is just incredible. And I was at lunch in Dallas, and my colleague, the guy actually who designed this device, went to an award ceremony in Malta. It was the MedTech World Awards, where we won the title of Femtech Product of the Year 2024. And, you know, it was just such an incredible way to, you know, start finishing the year, you know, real point of validation. And as I say, and like you highlighted, there's, you know, a lot of thought has gone into the design of this product. You know, we feel, and certainly from the feedback we've had, it meets the user needs that we were so careful to collect at the very beginning of our design process. And I'm really happy you just went back to that empowerment thing. One of the things that's come out of all the work I've done, even from 2009 to today, at various times over that kind of 15-year period, has been the word empowerment and the phrase active involvement and less of a passenger, and, you know, like I was doing something positive. And one person actually said something really interesting. She said, this is a patient, she said, you know, if I think about my journey and what this would represent for me, she said, this could be something that was the first time someone else hadn't touched me. It was me doing this, and my hands on my body rather than someone else. And she said that would have really made me feel good. So it's incredible. You know how some pieces of technology can really bring out an emotion, and actually, yeah, you know, I think I think we're somewhere towards that, which is really quite special. But you know what, Terry, we did say we didn't want to go on and on and on. And what I'd really love to do is come back and talk to you about how our launch is going. And I would also like to put out a call to the patient communities out there that, we're going to be, this is coming, and we can rely on our patients as much as we can, as much as our surgeons, to be our champions, and that's really important to us. We work very closely. She's on the management team, a patient champion. In fact, could get her on another time. Kylie Musa, she's fantastic.
Harley, yes.
Yeah.
You took the words right out of my mouth, because I was going to say, patients drive change. So I am going to have a double call out. Patients ask about BLOOM⁴3.
Yeah.
It is on the market. It's coming. It is here. It is now. We need to start asking about it.
Yeah.
And here's why. I bulleted item some thoughts that I wanted to just wrap up with. Improve patient outcomes. This is why you need to ask patients. Improve patient outcomes, potentially reducing hospital cost and reducing return to surgery. Reducing necrosis. Patients, I hear it all the time in my group too, Saahil. Reducing necrosis and patient trauma. No one wants to face that. And then, of course, the big word, supraphysiological preparation, improving blood flow before surgery. Do I get an A+ for saying that twice in the interview?
Yes. Yeah, you do. Yeah, A++.
A++. I mean, I can't thank you enough. And yes, let's circle back. Let's do a follow-up on this. I'm in for 2025. It's going to be a great year for you. I'm really excited that I saw you at the front end, or not at the front end, but in the middle of your roadshow, and now you're back home, and look at the news you have to share. Bravo, my friend. Bravo.
Thank you so much, Terry. It means an awful lot from you. It really does. And I don't take these comments for granted at all. So thank you.
I can tell. Thank you so much for joining me today. I really appreciate it. Ask for BLOOM⁴3 patients.